I'm an ultrasound technologist and one of my registry is in breast. This is my job. Try to find cancer as small as possible for the best treatment so life could be safe. The American Cancer Society recommend a plan for personal action that include one breast examination a month per yourself and one breast examination performed by your doctor once a year, and once a year a mammogram. The self-examination is performed with 3 fingers pressure, trying to find any changes in your breast. You will squeeze the nipple to see any nipple discharge. If it's bloody discharge or clear liquid, that has to bring up to your doctor to do more studies. If it's any other color discharge, milky or dark green, that's normal. In the shower is a good resource to try to find any difference in the breast because the soap and the water will help. And in the mirror is to see and look any asymmetries and to look for any lumps or indentations, nipple retractions or deformities. The mammogram is to be done once a year after 40. The NCCN guidelines for breast cancer screening, average woman risk includes one breast examination every year from 25 to 39 years, that recently changed, and once a year for women over 40 and over. And that will include one mammogram per year after 40 years. That was for the average risk woman, not the ones that have history of breast cancer in their family, though that will be different. After the mammogram, you get called back from the hospital. Most probably it's just to get new images of magnifications or spot views, which the radiology will need just to identify what kind of density you have. If it needs more study, probably will be the second one will be the ultrasound to detect if it's fluid or solid, the mass. If it's fluid, it's not cancer. Fluid it will never become cancer. It could disappear or come back, but it will never be cancer. A solid mass, if it's suspicious, with suspicious artifacts and qualities, then it will need a breast biopsy, ultrasound guided. This will be done in the same ultrasound room with the same equipment, and the radiology will perform it, guided by the ultrasound tech. The American Cancer Association define breast as dense breast as a lot of fibrous and glandular tissue, not fat. If the breast is fat, it will be easy to be seen under the mammogram, any cancer or any suspicious area. But if the breast is dense, it will be the need of the ultrasound to see any masses hiding in that dense tissue. In the mammogram, it will look white, the same as the mammogram dense tissue, and cancer will not be easily seen. That patient will be greatly beneficial with the ultrasound because we could see that dense white tissue in the mammogram, we could see it different in the ultrasound. And we do find a lot of different tissues and masses that need more workup. Could be biopsy or more views. the early breast cancer detection makes a big difference in the treatment and the prognosis. And talking about breasts, I hope it helped somebody out there that just with the breast examination or the mammogram could find breast cancer early. For the guys and males, it's the same thing. Usually pain behind the nipple is gynecomastia, which is not breast cancer. But for the guys, any masses away from the nipple, not painful, hard, that will need more, then you will have to take it to the doctor and needs more evaluation. Thank you. I hope you learned something.